Now, what about medical needling? I know this is something that you've been, investigating and working with for many, many, many years, and you're really the pioneer of microneedling. So, what are the indications for the fundamentals behind the needling, microneedling?
Well, this may sound rather radical, but I generally don't know of any patient that comes into my office who wouldn't benefit from medical needling. Mm-hmm. Even some of my patients, they come in, they haven't got any wrinkles, but they're now 30, 35, and they know they are starting to decline. The thickness of their skin is starting to change, and we can do something for them. And by preemptive, because we want to keep young skin, in this particular case, it's the same as skin care. If you start early enough, you're probably going to go through 20, 30 years into your 50s, into your 60s, and have remarkable skin. So we've got quite a number of people doing this already. They come in maybe once a year, maybe every second year. They have a series of needling treatments. And needling will do much more than any peel can do, much more than any laser type of treatment can do, because it will instigate regeneration of tissue. So I use the needling very often. And of course, in my older patients, when I've done facelifts, I recommend that they should have needling to get a beautiful result. Yeah.
There's different kind of devices, different kind of length of needles. So what's the difference?
Generally, I use about a 1 millimeter needle length to treat wrinkling, fine wrinkling, unstable skin, lax skin. That's good enough. But when it comes to somebody with acne scars, especially deeper ones, or people who are unfortunate enough to be burned, then I use the 3 millimeter rollers.
You need to provide some level of anesthesia, I guess.
When I use the 3 millimeter needling, we need a more profound type of anesthetic than we generally get with topical anesthesia.
So you mean like infiltration?
Infiltration.
Okay.
Sometimes I recommend to people, look, let's do a general anesthetic. Then I can do their face, their neck, their décolleté, their arms,
you can combine with other procedure anyway, so.
Yes.
Yeah. What about the downtime with these procedures?
Well, when you're using topical anesthetic, we tell the people, look, this is an office procedure. You come in, you go out, you go to work the next day. So you just have to take off time to come for the treatment. I, for example, I'm quite happy to do the needling and then go out for dinner at a restaurant in the evening.
Okay, not even red? Not even...
Oh, yeah, no, you look sunburnt.
Okay,
you look as though you've been in the sun.
So you can cover with makeup? I mean, there's no...
Yeah, and you look a little bit tired. I tell the people, you will look tired for that week. And just when you're beginning to look radiant and lovely, you come in again and we do another one.
So you repeat, what's the schedule about, like some 4, 5, 6 needling procedure? It all depends on the indication, of course.
We generally recommend 6.
6. I think that many doctors or cosmetic physicians are trying to compare fractional resurfacing with microneedling. I know that's quite different, but what is the difference between the two?
Well, I think the instigation of collagen from the fractionated lasers is from the death of tissue. Whereas with the needling, you get regeneration through the release of platelets from the bleeding.
There's no tissue destruction actually with the...
There's basically no tissue destruction, and that's why there's no sort of finite number of treatments that you can have with needling. I've had over 50, and if you examine my skin, and I have examined my skin, by the way, I've examined my skin over a year, and the scars just don't show up. You can't detect any scarring. You just see normal skin.
But do you see a fibroblast proliferation really leading to collagen? Do you
Well,
can
if
document it?
you take a picture of before and then you needle and you check, you will see much more collagen deposition, much more elastin. And it's the deposition of elastin that seals the fact that this is regeneration and not simple collagen formation. Because no other treatment described so far has stimulated the production of elastin. And we see this regularly when we analyze, when we do histology, and we stain for elastin. The elastin before and after, significant difference.